when it comes to treating pain in the body, there's two sides to every pain equation. On one, there's the area of the body that hurts. So someone's knee, their elbow, their low back. And then two, there's all the things around that situation, which is the reason why it hurts. So when we look at things from a mechanical pain standpoint, if someone's knee hurts, is it that their quad isn't strong enough, or is it that everything else in the chain isn't dispersing force enough to offload the knee? So we need to do two things. We need to strengthen the quad. We need to look at the quad and see what it's doing in those positions that hurt. If someone has pain as they are going downstairs, it's a very quad dominant movement. So maybe their quad isn't strong enough, or maybe they're not getting any support from their hips or down at their foot and ankle. So is it a positioning thing all around where the ankle and the hip aren't supporting the knee in the middle? Or is it that the quad itself isn't strong enough to go knees over toes? We got to do both of those things. We need to strengthen up at the hip. We need to make sure as someone loads on one leg that they can support their knee in that position. And we need to make sure that the hip and the ankle have enough stability to support the position of the knee. Both of those things are true. If we look at low back pain with lifting, is it that as someone goes into a deadlift position that they can't hold that position of their lumbar spine? Well, maybe we need to do a rector strengthening of the spine, but we also need to look at the connecting chain, which is going to be how well the hips work, how well the shoulders help pull back to support that movement. So with everything, there's always two sides to pain, making sure that we're calming down the symptoms of the area that's aggravated, making sure that we're retraining and strengthening that specific painful area, but then also making sure that the connected chain of movement is equally strong. The last example I'll give is if someone has tennis elbow, is it that their elbow extensors here, let's say if they're doing a swinging type of motion with a racket, is it that the elbow is not strong enough, or is it that the shoulder isn't getting put into position to help with the movement and then the elbow is doing all the work? So we need to, one, calm down the elbow. We need to strengthen those muscles in a way that's not painful, but we also have to connect it back to the chain, the whole entire movement, to make sure that this area isn't doing all the work. So anytime with any specific rehab injury that you're doing, making sure that one, you're calming down symptoms, two, retraining the muscles in the painful area to do the activity and it no longer hurts. But then three, and most importantly probably in this whole equation, is making sure that the surrounding musculature, the areas that are likely compensating for the reason that someone's having pain, that those surrounding areas are also strong and also firing in a way that isn't leading just to an overuse or overload pattern. So there's two sides to every pain, and make sure you're treating both the direct area, the source of the pain, and the surrounding connecting tissue that's associated with that pain.